My name is Dr. Anoop Agrawal. I am an interventional cardiologist at Care Hospitals, Hyderabad. Today, we are here to talk about TAVR. TAVR is a recent addition to the field of interventional cardiology. It stands for Transcatheter Aortic Valve Replacement. It is also known as TAVI, where it stands for Transcatheter Aortic Valve Implantation. Now, the procedure is essentially there to treat a disease called aortic stenosis. Let me explain to you. All the human heart, they have 4 valves. And all the valves, their function is to allow blood flow from one chamber to another chamber without any restriction. These valves, they open and close with each heartbeat. And they do it every single time, every single day, 7 days a week, 365 days a year, since you are born. These valves, they function about 1,00,000 times per day, opening and closing. In doing so, some of these valves, they degenerate. These valves, they go through wear and tear. Now, body tries to help it by healing. And in doing so, it causes valves to become thick, restricted. They don't function the way they are supposed to. One of such valves, called aortic valve, is the most important valve. It is situated right between the main chamber of the heart, called left ventricle, and rest of your body. This aortic valve, when it gets diseased because of continuous injury and healing, the valve that does not open very well, it puts undue pressure to the heart. Now heart has to work much harder to eject the blood out. And eventually the body doesn't get as much of blood that it is supposed to. These people, when they develop this so-called aortic stenosis, they feel fatigued. They have discomfort in their chest. They may complain of breathing difficulty, palpitations, giddiness. They may even have loss of consciousness. Severe aortic stenosis will eventually lead to a person's demise. It is one of the most deadly diseases that we know, the outcome of which is even worse than some of the stage 4 cancers that we have. Now, while the stage 4 cancers are difficult to treat, aortic stenosis is relatively straightforward in its treatment. So far, all you needed to do was have the cardiac surgeon on board who would open your chest, take the old valve out, replace it with a new valve in, and all of a sudden your heart feels happy because now there is a valve which is functioning very well. It doesn't allow that kind of restriction that your old disease valve was doing. While the treatment is quite straightforward, the problem is so many people don't go for surgery, either because of the fear of surgery or because surgery is too high risk for them. These patients so far did not have any option. Now, just like an angioplasty, where a patient is brought to the cardiac catheterization laboratory, and using plastic tubes called catheters, we can take these valves which go through the blood vessels, just like angioplasty, and we replace that valve to the place of diseased aortic valve. All of this without any surgery. Now imagine you have a treatment option where you can replace the diseased valve with a new well-functioning valve, all without any open heart surgery, without any sutures, without any cut, anything. Those patients who otherwise could not undergo surgery because of high risk or who feared surgery, all of a sudden these patients, now they have an option which is much viable, much less riskier, very comfortable, and much widely applicable. So how do we do it? These valves, they are made up of metal that you can squeeze. So I'll give you an example. One of these valves is this called evolute. This valve is made up of metal inside which there are leaflets. These are the leaflets that function as the valve. So what we do is we squish these valves in small plastic tubes. Now these valves have a very small crossing profile. They're going through a catheter. Catheters are plastic tubes like these. So these valves, they're going through the catheter, and through which Now you can put the valve where they are supposed to, and as soon as you release it, they take their position. These valves, they stay at the place where you left it, without any sutures, without anything. And now these valves, they function very well. So this TAVR technology has really revolutionized the way we treat aortic stenosis. Now you can treat those patients who otherwise couldn't undergo for surgery. There are various kinds of TAVR valve available in the market right now. Most of them achieve the same process. Now TAVR is done just like an angioplasty, which means a person walks into the cath lab. We put them under local anesthesia. We do not put them under ventilation or general anesthesia. We put a numbing medication in the groin area, and through that we use these catheters. It's a completely painless procedure. Patients should not experience any pain. They're mostly awake during the procedure. The entire procedure takes about 1 to 2 hours with a procedural success rate that reaches almost 98-99%. These patients, we watch them in the ICU for 1 day pretty much, where they're awake, they are talking to their family members, they are eating, they can even walk. Next day they go to the general ward, and within 2 to 3 days they go back home. These patients, they have no surgical scar, they don't need any rehabilitation program or anything. They are back to their life within 3-4 days with no sutures, nothing to worry about. So the disease which otherwise was almost a death sentence for a lot of our patients now can be treated with the ease which is as simple as getting an angiogram or angioplasty done. TAVR in the last 2-3 decades can be considered as the most disruptive technology that, not just in the field of cardiology, but as a general, I wouldn't shy from saying that in the field of medicine that we had, this technology or this therapy option is going to revolutionize the way we see aortic stenosis. An understanding of how to deal with valve therapy using catheters also allows us to develop therapies for other valves. I can imagine in the future we will be able to offer catheter-based therapies for most of the valve diseases, for which right now the standard of care is surgery. At this point of time, this therapy is only available for aortic stenosis. So I take it to my heart to make sure any patient, if that person has severe aortic stenosis, which is aortic valve not opening that well, and if they don't want to undergo surgery or cannot undergo surgery, these patients should not go home and suffer. These patients, we should be able to offer TAVR. CARE Hospital started doing it about 2 years ago. We have been pioneers in this. We had the highest number of cases in this region, which includes Telangana and Andhra Pradesh and around this area. And we have a working team that includes cardiac surgeon, anesthesia, multiple cardiologists with special expertise in imaging, echocardiogram, CT scans. We have a host of cath lab technicians and ICU nurses who have been specifically trained to manage patients with aortic stenosis and those patients who come after TAVR procedure. Our success rates so far have been 100%, and we aim to achieve this even going forward. At CARE, we take it to our heart to make sure all our patients, not just for TAVR, but for any other procedure, they get the best of what medicine has to offer, so that when they come out, they have the best chance out of everyone. Thank you.